Hello, guys. I'm Dr. Janaina Koenen. I'm a doctor. I'm an endocrinologist. And today we're having a different podcast. So I'm going to be interviewed by a very dear friend, Dr. Maira Soliani. She's an anesthesiologist and she's a fasting specialist in Brazil. She has the best fasting clinic in Brazil. She's an IDM clinic here. She studies a lot about it and about chronobiology, sleep, fasting, and all its applications. So I'm going to interview her too here. But today she's the one interviewing me. So welcome to this podcast, Maira.
Thank you so much. It's an honor to be here in the English version of your podcast. And first of all, for anyone that's watching us and is Brazilian, you might be wondering, why on earth are these two Brazilians, Portuguese speaking doctors, speaking English on the YouTube channel? But I'm here to explain, okay? We have many colleagues around the world, and we know that they can't be bothered reading subtitles. So if we want to be heard by them, we better speak English. So if you don't want to listen to us in English, you have the Brazilian version podcast. But we're here today to talk about ketogenic diets in English, okay? We still want to reach the rest of the world that doesn't speak Portuguese. So sit back and enjoy. And Janaina, welcome. It's an honor to interview you today. So let's talk about the ketogenic diet. So please, can we start talking about the history, how we discovered the ketogenic diet, this incredible approach?
Well, Maira, I love talking about this subject. It's something that changed my life. I've been doing a ketogenic diet since 2016 because I had complex migraines and it really changed my life. So I started studying it, and I knew, being a doctor, I knew that ketogenic diets were done for epilepsy. So I started studying these papers. And some people say the ketogenic diet is like fat diet is like fashion. It's something for cool people, but it's nothing about it. Nothing like that. The ketogenic diet is started in the beginning of the 20th century. Actually, they began fasting patients with refractory epilepsy, and they had really good results fasting these patients. Some patients even cured their epilepsy. But with children, it was something really odd because, you can't really fast a child for a long period because they actually lose weight. And of course, if you are going to control refractory seizures, it's good, but not for long periods of time. And when they found out that patients were getting into ketosis and what was this state of ketosis, and that actually the ketones were controlling the seizures, after this, they began studying other ways in which they could reach ketosis without fasting the subject. And the ketogenic diet came from that. So ketosis is a state in which you lower your carbs or you fast, right? And if you fast or lower very much your carbs, like less than 20 grams per day, your insulin drops dramatically. And the counter-regulatory hormones like glucagon and cortisol, they rise. And so you begin burning fat for means of producing energy in your body. And this fat, part of it is converted in fatty acids, and most of your body will use them. And some part of it will be converted into ketones in the liver. So these ketones are the beta-hydroxybutyrate, acetoacetate, and oh my God. Beta-hydroxybutyrate, acetoacetato, I have a blank in my mind.
Cetona.
Yeah, and acetone, of course. And it will come to me. Right, acetone. And these three keto acids are very important in our body. And most of your brain will use them for energy. And actually, the beta-hydroxybutyrate makes more ATP per molecule than glucose in your brains. And it's good for focus. So it's not only for controlling seizures, we'll talk about it afterwards, but in epilepsy, the ketogenic diet and these ketones, they are anti-inflammatory and they stabilize the brain. So they control seizures really, really well, right? And what about the brain, the part of your brain that uses glucose? Of course, you have gluconeogenesis from your liver, which is much more than we actually need in a daily basis. So everything works out really fine, either if you fast for long periods or if you go on a ketogenic diet. So on a ketogenic diet, you actually eat 20 grams of carbs or less per day, and you eat not much protein, because if you eat too much protein, the insulin goes up too. So you eat like 15%, 20% maximum of proteins from total daily calories, and the rest comes from fat. So people actually get scared. Oh my God, what fat is that, right? But it can be like a Mediterranean ketogenic diet. It doesn't have to be only saturated fats, okay? It actually can be quite nutritious and healthy if you do it. And they found out that this ketogenic diet controlled the seizures and the epilepsy in these children very well. And some even got cured of the epilepsy after 2 years of ketogenic diet, right? So it became like a promise, a very interesting promise. Of course, it's a restrictive diet. It's complicated in a society.
It has to be well formulated, especially for children.
Yeah, very well formulated. Some people have concerns about bone defects and growth problems. And if you actually, some of these studies were done after the anti-epileptic drugs came into the market, and some anti-epileptic drugs actually by themselves, they can harm growth, yes. And they cause vitamin D deficiency also. So it's a bit fuzzy. They don't really know exactly what is causing the growth problems in these children. But it is a fact that if you go on a ketogenic diet, you have to worry about growth, and you have to worry about supplementing calcium and vitamin D in these children. And actually, the less anti-epileptic drugs you use, the better, because they have lots of side effects as well. And ketogenic diet comes as a tool, a very interesting tool for treating epilepsy.
Okay. Yes, something that I think is really important to talk about is that ketogenic therapy is a therapy. And just as a medication, it has side effects, but we always have to triangulate and to think about what's better, and can we reduce medication using this therapy? So it's a therapy, so you need medical supervision, as well as a good nutritionist, dietitian, to make sure your ketogenic diet is very well formulated, especially when we talk about children. And something that is really interesting to talk about that most people won't even imagine is that we have several strategies inside the ketogenic strategy. Like we have many combinations and strategies to increase the fat and lower the protein. And we can play with that as long as we keep the carbs low, but still there's like a million combinations. The first time I realized that, I watched the Dr. Eric Kossoff talk about it. He wrote the first book about it. So if you could tell us a little about these different kind of strategies, especially when we target cancer is one thing, and epilepsy is another, diabetes is another, and losing weight is a completely different one. So can you talk about that, please?
Okay, so well, when we have children with epilepsy, okay, what is the aim? What is the goal? Control the seizures, right? So if you can flexibilize, if you can make a diet that it's easier to follow and it actually reaches the same objectives, the same goals, why not, right? So some children have a hard time going on a ketogenic diet. But if you, for example, which kind of fats can we use? So we found out that if you use MCT oil, right, with this medium chain triglyceride, it's most of it is converted into ketones in the liver. So if you increase the ratio of MCT oil in the diet, you don't have to go to lower so much your carbs, and you still get into some level of ketosis in these children, and they can control their seizures anyway. So it's a bit tricky there, because if you start with 50% of MCT oil in a diet, they have diarrhea and they can have a gastric distress. So you have to go very slowly and gradually increasing the MCT oil in the diet, and then eventually you get into a ratio that you can still raise a bit the carbs, right? But the child will be in ketosis and it will have the seizures controlled. So you can go into this diet. You can do the classical diet.
Lots of different ones.
Yeah, the 70% fats and not MCT oil. you can actually go to a modified Atkins diet, which it's more flexible. It doesn't work all the time in epilepsy, but some children have control with it and go better in it and can keep the diet for longer periods. So it actually, we actually do anything that helps,
Yes.
right?
That's true.
Yeah, and now we have exogenous ketones, which help a lot, right? Because before they tasted awful, and it was very hard.
Gasoline.
Gasoline to drink. And like when my father had cancer, he hated it. He said, "Oh, this is so bad. It tastes so bad." And now we have this great exogenous ketones and ketone esters, which are tasty and they taste like, I don't know. You feel like drinking them in the evening with ice, right?
Yeah,
because they taste so good.
We just drink for fun now to have more focus.
Yeah, to have focus.
No disease, right? Just focus.
Yeah. So we have exogenous ketones, which can help a lot in many conditions, even in actually, of course, in epilepsy. But after this, they all disappeared. No one was talking about them anymore because we have the drugs, right? So, okay, if you have the drugs, eat whatever you want. Doesn't matter as long as you're taking your medication. And it's been done for a while, for some years, until Charlie got refractory epilepsy, which was a child that didn't respond to anything. And then they put him on a ketogenic diet, and quickly he got better and better. And now we have Charlie Foundation because of that, which is a great website if you want to learn about it and learn how to prescribe it. It's everything in English. So for Brazilians, it's very hard because, unfortunately, many Brazilian doctors don't speak English, don't write in English. They only read with lots of difficulty in English. And you have this fantastic website, which is Charlie Foundation. They have online courses, they have recipes, they have an online tool, which I strongly encourage you to look for it. And now all the papers start writing again. And if you go to PubMed and put ketogenic diet and neurological diseases, you see, oh my God, it's so much, right? And okay, so this is for epilepsy. If we talk about other diseases, like for cancer, for instance, right? In cancer, you have the ketogenic metabolic therapy. So we can do a whole podcast on it. I don't believe in ketogenic diet alone for cancer, but we do have a randomized clinical trial in breast cancer with excellent results, only with the diet, especially in patients with no metastasis, long distance metastasis. So we have even like survival rates improvement and the size of the tumors reduced only with the ketogenic diet, right? So we do have some studies with the diet alone, but I don't believe in the long term that only the diet will control cancer. But ketogenic diet in cancer is different. We actually look for high levels of ketosis, and we have an index. It's called the glucose ketone index. Not everyone uses it. Some groups don't really think it is important. Other groups do think, and we have some publications talking a lot about the GKI. And this GKI index should be less than 1, but if it's less than 3, it's great. And you have even the Keto Mojo glucometer. It calculates it for you. You have apps that calculate it. You have websites that calculate it. So you have to...
And it helps a lot to the adherence because the patient is able to really take control of the treatment and like be part of the treatment and not like, I trust you, so do whatever you want. So I think it's a very helpful tool, especially to see the success, because it's not easy to adhere in a chronic manner, like a long time. So if you have anything you can constantly look at, maybe helps a lot.
Yeah, you don't have to do it all the time like diabetics do it. You prick your finger once a day, or twice actually, because you have to measure the glucose and the ketones, and then you calculate this index. So if you do it once a day in the beginning and you see you're doing fine and your ketone levels are high. For example, when you're doing chemotherapy and you have to take glucocorticoids, you'll see it's very hard to get into ketosis. So, and actually ketogenic diet, it saves you from glucocorticoids in some conditions, like for example in glioblastoma. If you're going on a ketogenic diet, the edema, the brain edema, it's reduced, and you don't actually need, right, so much of glucocorticoids, especially knowing that corticosteroids, they increase mortality in cancer. And in brain cancer, it's like published. But since they don't have anything else to do, they give you corticosteroids. But if you go on a ketogenic diet, this may help a lot. We have some supplements too, There's some studies with Boswellia in high doses in humans, improving a great deal of brain edema. So that's why I think we should really study supplements and off-label drugs for cancer as something else, something more to help us treat this disease. So this is for cancer, right? For a ketogenic diet, for migraines, for example. Sometimes you don't even have to be in ketosis to improve your migraines. Sometimes only if you take milk out of your diet or gluten, you feel better. Some people have non-celiac gluten intolerance and have migraines because of that. So sometimes a low-carb diet already helps. But some people that have complex migraines, they need ketogenic diets, just like in cancer, and even the exogenous ketones as well.
Yes.
And for PCOS and for losing weight, you don't need ketogenic diet.
I'm gonna suggest we talk about this in a broader manner before we start
Okay.
really diving into the application, so the layperson can really understand where we are.
Okay.
So I think that ketogenic diets, it's becoming more and more studied in various different approaches because it has a mechanism that's really interesting for us right now, because our modern society is very in a insulin resistant state. So can you explain to us how this insulin resistant state can be improved? Like, I don't know if my English is terrible right now, but okay. How can we make it better, the insulin resistance, using the ketogenic diets? What's the mechanism behind, and why do we have so many, like, it seems random diseases altogether that can be improved by ketogenic diets? So explain to us.
Okay. Your English is perfect. Don't worry about that. It's great.
It's a work in progress.
Yeah, mine too. I told you guys in the beginning that I said pardon my English because we are not native speakers, so we're trying hard to communicate with you in English. So if you don't like mistakes, don't be here. Go somewhere else. So about the insulin resistance conditions, we have chronic non-communicable diseases nowadays that are killing everyone much more than infectious diseases. Like in Brazil, cancer is the first or second disease that kills more, and cardiovascular diseases, and then you get diabetes, right? And all three of them have insulin resistance in the root, in the main cause. And yes, many diseases of modern society are related to insulin resistance because everyone is eating processed food in front of their TV. After pandemics, no one's going to work anymore because they're doing home office, so they eat all the time, you know. And when you eat all the time, especially processed food and carbs and refined carbohydrates, what happens is your insulin goes up. And the less you exercise, it goes up and up. So people are doing less exercise, they're eating more, eating processed food, sleeping less, sleeping lameless, like they don't sleep well, poorly. Yes. And they have stress, which raises cortisol and increases insulin resistance as well. So everything about our behavior nowadays, everything about our behavior and everything about our children's behavior, which is worse because things are getting much worse, brings us to
earlier,
and
right?
Earlier.
The problems are starting to begin earlier than we could be ever prepared.
Yeah. So so we have to deal with this, right? So insulin resistance, I think it's what's rotten in society.
It's like Dr. Ben Bickman has a very good saying. He says it's a plague of prosperity. So yeah, we're like harvesting all the evil. Like being a modern society has wonderful things. Like we can talk. I'm in São Paulo, you're in Belo Horizonte, and we have all this technology, but we have a big price to pay. And the way we're eating, not sleeping, and not caring about the basic to be well, like healthy, we're paying a price, and we're very insulin resistant at the moment. So for a person that eats all the time, food frequency is like huge, and sleep less. So if you look in a 24-hour day, you spend most of your day stimulating your pancreas to release insulin. So for all the people that are in this way, like a way of lifestyle, how ketogenic diets can help to lower these insulin resistant states.
So, knowing that everything is driving us to insulin resistance, and the last thing we're doing also as well is accumulating visceral fat. This visceral fat is accumulated by all the things we said before, especially by the excessive ingestion of fructose and fructose drinks with added fructose and sugar and
highly processed food.
Highly processed food. So you have all this visceral fat, and this visceral fat increases inflammation and worsens insulin resistance. Okay, so ketogenic diet, what does it do? So you eat less carbs. Okay, you eat more fat than carbs. It doesn't mean you have to spend your whole day eating fat. That's not what we're talking about here. Okay, so if you have to lose weight, you have to decrease a bit of your calories. Yes, but what we change the ratios of the macronutrients. Okay, so no, it's not okay to drink coconut oil the whole day long. It's not going to make you burn fat like that. Okay, so let's say you have a 2,000 calorie diet and you have to lose weight. If you have to lose weight, okay, so you have to decrease a bit of your calories, do more exercise, yes, but we change the macronutrients. You take out the processed food, it all goes away. You reduce your carbs, you increase a bit of your protein if you are going to lose weight. Okay, if you have cancer, we said it earlier that you have to reduce protein too, but you increase a bit of protein, so let's say 20-25%, and then you increase your fat to 70, 65, 70, 75, depending on your goals. Okay,
you just tip the pyramid and
yes,
turn it all around.
Yes, and you take all the grains. Okay, so it's basically a paleo diet. It's a grain-free diet, and it's no processed food. So it's not only ratios, it's quality too. So when you talk about reducing inflammation and reducing insulin resistance, inflammation comes from processed food too, and the quality of food. So it's different if you have 100 calories from broccoli and 100 calories from sugar. The hormonal response in your body is different, okay?
Yes, and before you dive into the ketogenic diet, I think it's very important to mention the Kevin Hall study that he simply changed unprocessed food, switched to unprocessed food, highly processed food diets. So what happened? The appetite is like regulated, and the people in the study naturally ate 500 calories less without any diets or anything. They just reduced the processed food. So just by doing that, you already get a change in your appetite regulation, in your hormones. But you can go deeper, like you can increase the dose of the metabolic change you want in your mitochondria. So when you're ready to do it, you can change the ratios. And now you can talk about the ketogenics, just an introduction.
Yeah, what you said about when you're ready to do it is a very important thing, because we can talk about it in the end, like how to begin. Okay, we'll talk about that. But since you said about the change in the quality of food, Robert Lustig published also. We love him, right?
Yes.
He published this paper about children, right? So if you gave children fructose, like from fruits, from high corn syrup and juices and cereals, and if you have the same amount of carbs, okay, but this children here, this group ate fructose, and this group ate starch, like potatoes, sweet potatoes, okay, so it's the same amount of carbs. They change only the quality of carbs. Yes, so this one here from the starch group had less liver steatosis, okay. They lost weight and had metabolic changes, which were healthier than this one, which accumulated liver fat. So even this kind of change is important. So it's not only to lower carbs, the quality, the type of carbs. So when we talk about...
The thing is, in this study, I just want to add, because it's really interesting. He didn't even change like for good quality carbs. He just changed the fructose to glucose. So it wasn't good food, okay? He didn't do that. he changed, like he even says that instead of the donuts, he changed for bread. It was simply that.
It's
It wasn't the
fructose
food.
and starch.
Yes, he just removed the juice and the concentrated fructose out of it. So what is like amazing to see is that this simple change, it wasn't even a good diet. The children in less than 10 days improved metabolic syndrome. Like they lost fat, visceral fat, the liver steatosis reduced, and the lipid panel and the ALT especially decreased. So it's amazing that in 10 days, just by changing less fructose to glucose, without changing the ratio, we can get a good metabolic change. So can you imagine how many things we can do changing the ratios? So that this is
and
why
the quality
ketogenic is so amazing. So now we can talk about ketogenic.
Yeah, we're bringing all this up because it's important, that we're not only ketogenic diet advocates. We like the ketogenic diet, but it's not like ratios only. We like quality. So we really believe, and we are showing, we're bringing this data to you so you can check it out, that a calorie is not a calorie only, right? So this is very important because you can do dirty keto and you can do clean keto, like paleo ketogenic diet. That's what we do. Okay, and it's important that there are many definitions of low carb diets and ketogenic diets in the literature, right? And especially when they studied in animals, they use ketogenic diets with vegetable oils. Yeah, this chow is disgusting. It's nothing like human diet. I mean, mice are not human, so I don't think they're even the best animals to do a study about food, at least, about nutrition. Okay, but well, then, so when we go down the carbs, right? Now we already talked about the quality of the carbs. Okay, we don't go down in the carbs. Insulin drops dramatically, right? When insulin drops, then we can use fat as fuel. Okay, liver makes glucose for the cells that need it, and we live on fat. We thrive on fat. We thrive on fatty acids. It's great. Okay, ketones are great for the heart. We have studies, and after heart attack, if you raise ketones, you improve the outcomes, improve heart function. After a stroke, if you go to ketogenic diet after a stroke, you reduce the gray zone.
The gray zone, yeah.
Right, and you have better outcomes. So it's important to note, right, that ketosis is good for many organs in our body, not only for epilepsy. And we'll talk about it afterwards when we
dementia is a good example for dementia,
as well. Alzheimer's disease, right? Yes. So and how do we lower insulin resistance? So by two mechanisms. First, because we lower insulin, right? And you know that the muscles, they are insulin resistant in this state. When you go, for example, and do exercise for 24 to 48 hours, glucose enters the muscle without the aid of insulin, right? So if you go to ketogenic diet and work out, that's the best thing you can do. Yes, because the insulin resistance doesn't drop from day one. Okay. You go on a ketogenic diet. It takes a while, but you see it. If you see the blood exams, the blood tests, I see in my patients like monthly, insulin is like 50, fasted insulin 50. In 1 month, it's like 12. So it actually happens. You see it happening, right? The other thing that happens is that visceral fat is consumed first. So you burn your visceral fat first. And this visceral fat was responsible for most of the inflammation in the first place, right? Producing interleukin-6, interleukin-8, and TNF-alpha, and all these cytokines that cause lots of disease in us and raises your cancer risk and your cardiovascular risk. So if you burn this fat, and you see it in the studies, actually the better outcome you have and steatosis and LFD, it's fasting and ketogenic diet. Like fasting is even better than ketogenic diet for that.
Yes, it's more potent because ketogenic diets are a way of mimicking fasting without fasting, but nothing compares to the real deal.
So I'm talking to the biggest specialist in Brazil in fasting.
It's a big bias. But we're here for the ketogenic today, so
we'll talk about fasting. Yeah. Okay. So, but if you decrease visceral fat, you decrease insulin resistance. That's for sure. And if you decrease the fat inside your liver too, you improve insulin sensitivity. Because one of the things that happen when your liver is busy all the time working out the excess food you eat, right? And excess fructose and metabolizing the fructose and the ethanol and all the beer you drink. Nothing against beer itself, but it's the perfect combination of sugar and alcohol. And for your liver, if you drink too much, that's not so good. So now, if you have insulin resistance, your liver doesn't respond well. So after you eat, it still produces glucose. It's like death. Okay, it doesn't listen. Okay, insulin is rising. Now I'm going to shut up and bring glucose in. No, I still produce glucose.
It's de novo lipogenesis in the maximum volume.
So when you go on a ketogenic diet and you don't exaggerate in calories, of course, then you burn fat. The fat of the diet and your own fat, which is very interesting if you want to reduce insulin resistance. Okay. Apart from that, yes, because this is okay. I reduce insulin resistance and I reduce visceral fat, and that's why it's anti-inflammatory. No. The beta hydroxybutyrate inhibits an inflammasome. It's called NLRP3. And I don't want to be very specific, but this inflammasome, I love him. I love it because I studied so much. It's the one responsible for gout. It's the one responsible for post-stroke changes in the brain and post-heart attack in the brain and the heart. It's responsible for COVID storm. It's responsible for cancer inflammation too. So it's very important we know how to inhibit it, right? And beta hydroxybutyrate, which is the most important ketone produced in the ketogenic diet and in fasting, right? And in the ketogenic drinks, in the ketone esters, inhibits this inflammasome. So it is anti-inflammatory per se, right?
And yes, and something that is amazing as well is that when you lower the inflammation, your insulin receptors work well. They really bring GLUT4 to the membrane, and we can uptake the glucose normally, as you probably in a decade wasn't dealing with glucose well. So it's a lot of different pathways that we activate when we fast or when we do the ketogenic diet using an alternative fuel. Yes. But something that is very important to say is that it's not only fuel. The ketogenic molecules are anti-inflammatory. We could even say that they are hormones because they actually work in every cell in a very special way. And we know how to deal with all the mitochondria, know how to make fuel out of beta hydroxybutyrate and the ketogenic.
And you could say it actually, it's interesting in epigenetics too, because beta hydroxybutyrate, it's a histone desacetylase inhibitor, right? So
it protects DNA.
It protects your DNA, actually. So everything you do, it's harmful for your DNA. So you're getting processed food, you're getting pesticides, you don't sleep, you're always stressed, you're taking sugar, your insulin is high, right? And then there's this diet that is anti-inflammatory, that inhibits histone deacetylases, which protects your DNA, and is epigenetically interesting, makes you lose visceral fat, and we know cancer is directly related to visceral fat a long time. So the more visceral fat you have, the more even the circumference, the abdominal circumference, is directly related to cancer incidence. So if you have a diet that could help improving that, maybe it would be interesting. But nowadays, people are always scared about ketogenic diets, right? Oh, it's going to kill you. It's going to destroy your bones. Oh my God, you cannot have performance in the ketogenic diet. You cannot go and do sports. How can you work out without a bread in your stomach, Mike?
Yes, something that is very important to talk about is the myths around ketogenic diets. So the first one I'd like you to talk about, like us to talk about, is, as I interrupt you all the time.
It's a talk. It's a podcast. It's a podcast. Yes. I want you to talk to me. If I wanted only an interview, I'll call someone that doesn't know anything about this. So I called you because true. I wanted to talk about it.
Yeah, so we could talk about doctors usually when they think about ketogenic diets, the first thing they think is, wow, ketones, that's very dangerous, because we we messed it up learning in medical school that ketones are bad and dangerous. We confound this with the state of high ketones. Can you talk about that?
Oh yeah, being an endocrinologist, I saw it all the time. And yes, in my graduation and in residence, the ketoacidosis, right? The diabetic ketoacidosis. That's something completely different, right? Because you don't have insulin at all. So no insulin, right? So this is for type 1 diabetics. If you don't have insulin, what happens? You produce glucose. You have neoglycogenesis, yes? But in a ketogenic diet, you do have insulin. It's lower, right? So it's lower up to the amount necessary to control neoglycogenesis or gluconeogenesis.
It's the protective break.
It's a protective break. Yes. So if you have a child, type 1 diabetes, very common, yeah? So it starts vomiting, vomiting. And the mom says, oh my God, he's not eating anything. I'm not going to give him his insulin because he'll have hypoglycemia. So the mom withdraws insulin. And what happens? The glucose goes to 600, right? Wow. And the child starts like peeing and gets worse and goes to the hospital and goes to the ICU. And almost dies. So
it's a very dangerous condition indeed.
Yeah, you can die. So insulin is very important to control the ratio and the rate that the liver produces glucose. So you need a little bit of insulin to balance that. Okay. So if you have no insulin, like C-peptide at 0, right, or lower than the reference, what happens? Then the liver starts producing a lot of glucose, and you have this very high contra-regulatory hormones being produced. So glucagon, if you have no insulin, glucagon is very high, right? And glucagon, it causes lipolysis too. So you burn your own fat and produce ketones, right? But if you have a little bit of insulin, glucagon goes up, but not so much. It's the same. So insulin, you only need a little bit for balancing everything. Okay, so if you have very high glucagon, then you start making lipolysis. And it's so fast and it's so aggressive that you lose muscle mass too, which doesn't happen in the ketogenic diet. That's a very important difference, right? When you have a diabetic ketoacidosis, you lose lean mass, not only fat. And you have acidosis, so your pH, your blood pH falls, because you have acids. When you go on a ketogenic diet, that doesn't happen.
Is acid, right? So it's important to say it's so much keto acids in your blood that your blood gets like very acid, and it's a fatal condition. It's very important to know that this is nothing like ketogenic diet. It's an out of control situation. So ketogenic diets are for insulin
control. Not abolishment. Yes. And the level of ketones in a diabetic ketoacidosis is like more than 10, 15, right? When you go on a ketogenic diet, it's like 3, 4. It's totally different. And when you do a gasometry and you see your pH of your blood, when you have ketoacidosis, it's less than 7.3. If it's very serious, less than 7.0, right? When you go to ketogenic diet, even if you fast for longer periods, like 5 days, 6 days, your pH doesn't change. It doesn't change. It's normal. It's from 7.35 to 7.45. It doesn't
because our bodies are programmed to switch fuels whenever we need. So if we're programmed and adapted, it doesn't make sense that being away from food for a long time would make us like in a dangerous situation. We wouldn't be here speaking to each other today if we were not adapted to periods of staying away from food. It's just that modern society has changed a bit. But it's very important to understand that ketogenic diets are nothing like a threat. Ketoacidosis is completely different. It's a completely different story. And this is just lack of knowledge. It doesn't make sense to worry about. A very simple way to compare both is ketogenic diets are like a very subtle rain, and ketoacidosis is a tornado. So it's very different. So we shouldn't worry about it.
I'm publishing now a paper on, it's like my student's doctorate paper on low carb diets and type 1 diabetes. So this is where people have, oh my God, these patients have this risk of ketoacidosis and you're giving him a ketogenic diet. What's going to happen? So we actually lowered the carbs until 25, 30, less than 50 for sure. And for 6 months, we were following these patients. It was not to be a ketogenic diet. We're not worried about being or not a ketogenic diet, okay? But it was, if you see the ratios, it was very, very interesting. We had excellent results and less hypoglycemia, no hospitalizations. And
well tolerated, right?
Yes, excellent. I'm looking forward to see it in the paper. So you'll wait for it and you'll see it.
I'll interview you again.
Yes.
When it's published, okay?
Yes, it's being submitted this week. So don't worry about ketogenic diet causing ketoacidosis. There are some cases published. We have to talk about this in the literature, okay?
Yes.
So for women who are breastfeeding, we have some publications on ketoacidosis in these women when they go keto, okay? And also in pregnant women, some cases, but these cases are mixed because these women, they had a starvation ketoacidosis. So they were vomiting a lot. And then they came with the ketoacidosis and they said, oh, they're doing a low carb diet. But actually they had starvation ketoacidosis is a bit different in pregnant women. This happens. But we don't advocate for ketogenic diet, hypocaloric ketogenic diet in pregnant women.
It's just like fasting. Yeah. You're not supposed to do it.
You're not supposed to do it. And
breastfeeding.
And when you're breastfeeding, you shouldn't go on a ketogenic diet. The ratio your body has to produce fuels for the baby is very, very, very fast, and you can't compensate it. If you go on a ketogenic diet, there is a risk, especially they don't know if it's a polymorphism, if it's something genetic, that some people are less adapted, because we know there are a lot of breastfeeders who fast and who go on a ketogenic diet and are doing really well. But we don't recommend you do it, especially if you don't have a doctor by your side. And I mean, it's such a short period of life, unless you have a real motive to do so. And if you do it, it has to be hypercaloric and, be with a doctor or nutritionist. Don't do it on your own, okay? But apart from that, it's very safe and there's nothing to worry about. Even children, it's being studied for a century, right? And we have like lots of children who did it and are doing fine, and they cured their epilepsy with that. So if we studied so well in children, they shouldn't be talking about this. It's like saying that it's bad for your liver or bad for your kidney, right, Maira? You can talk about this.
Yes. It's horrible, no? And muscle mass as well, it's another myth that is usually, it's just shenanigans. We shouldn't worry about it. We should worry on studying for more applications. We have a lot of these diseases that are related to hyperinsulinemia or insulin resistance, and they apparently have nothing to do with each other, like SOP, how do you say it? PCOS, NAFLD, type 2 diabetes, pre-diabetes, Alzheimer's disease, any kind of dementia, even gout. What else can we say about
migraine, gouts, acne? You have some studies in acne, very interesting studies in acne, and Parkinson's disease and ELA, lateral amyotrophic sclerosis, and also I forgot the other one. Neurological diseases, actually psychiatric diseases, bipolar disorder, schizophrenia. And actually anorexia, because anorexic patients, they fast because they feel so well when they fast, and they don't eat because they're into ketosis. So if you can convince them to do a ketogenic diet, they feel well while you can treat them. So there are some interesting studies in anorexia. And I
didn't know about that.
Yeah. So
it's new to me.
It's very interesting. And psychiatrists and neurologists, they study more ketogenic diets because they're familiar with this, because they saw it in epilepsy. And for binging disorder, actually, also the ketogenic diet it stabilizes mood. And we see it when we are in ketosis, we feel like calm and better, right?